all for being here. And I'm still at it. We've got people still coming in, so this is good news. So again, thank you all for being here. We are tonight presenting about community boards, and specifically the LEAP community board. So LEAP stands for Lifetime Eating and Physical Activity Practices. And LEAP has been we've been coordinating for a number of years. The community board is one of our exciting and newer initiatives. And so this is actually kind of a debut for the community board. And we're really excited about that. So tonight, the community board is joining us. We've got a number of folks who are part of it that are here. We're going to hear from 3 actual community board members. But I also want to recognize all of the other community board members who've joined us. I think, sorry, having a little trouble with my computer. There we go. So just so you know a little bit about LEAP, it's a collaborative. We have a number of nonprofit organizations, higher education institutions, and healthcare providers who are connected to it. Some of the major sort of partners right now are NCA&T, UNCG, Cone, the Greensboro Park and Recs, Guilford County Schools, and also the health department. So our work has always been about wanting to provide information to nonprofits, to researchers, to healthcare providers, and just decision makers in general, providing information to them that about physical activity and healthy eating, specifically for people here in Guilford County. So really thinking about local data, not averages for Guilford and the surrounding counties or anything like that, but what are we really experiencing here in Guilford? And we think about that with regard to a couple of different aspects of physical activity and healthy eating. We think about that with regard to individual choices that people are able to make, as well as the sort of like social determinants of health and the barriers that people are encountering that are not within their control, so not within their choice. So just really quickly, I want to make sure that you all understand kind of like basically what a community board is, and then we're going to go into some questions. So a community board is a formalized group that is recognized by researchers, decision makers, organizations. It's a group of residents from a local area or group of community members who are coming from a variety of different areas, often underrepresented areas, whether that's like geographically underrepresented, racially underrepresented, economically underrepresented, but they formally come together on a regular basis and they support community engaged research practices and decision making. We try to keep a community board flexible so that it's responding to what is happening within a community and what the questions of the research and decision makers are. But usually it's here as a way to act as a bridge between researchers and decision makers and a variety of different communities. So for tonight, we've got just a couple of questions that we've chosen that we're going to answer, and then we'll open it up for questions from the participants and the audience and people who are attending. I also do want to acknowledge who is here from LEAP, both the core research team and the community board. So I am going to stop sharing my screen and then go to my video settings. Okay. So from the LEAP community board, and if folks, when I say your name, if you want to just like wave and say hello. From the LEAP community board, we have Trey Godette.
Good evening, everyone.
We have Marisa Gonzalez.
Buenas tardes.
We have Cornelia Montaque. You're on mute, Cornelia. And we have Lynette Smith.
Hello, good evening, everyone.
And then from the LEAP core research team, we have Lauren Haldeman.
Hi, everyone.
Joni Chavez.
Good evening.
Jay Cochran. Emily Yankee. Marianne LaGreco.
Hello.
And Michael Hemphill.
Hey, thank you.
So thanks everyone for being here tonight. Hopefully this also means that if we venture into broader discussions about LEAP, we have enough very smart and informed people here that we can answer those questions together.
Kathleen.
So
Kathleen,
yes.
I'm sorry. I just wanted to announce that Dr. Lonnie Cockerham is also on the call. He is our interim executive director for community engagement.
Oh, great. Thank you.
Thank you for that, Joni.
All right. So we are going to go ahead. Yes, thank you. We're going to go ahead and get started actually with a poem that the community board created. And Nia, do you want to start by explaining the poem?
Okay. The following poem is called Dear Researchers. It is a collective poem created by the LEAP Community Board in response to the question, how do you want researchers, decision makers to engage with your community?
And it goes something like this. Dear researchers, listen. We want you to listen. We are real people and we matter. We want to be able to talk and give our ideas, to have our suggestions considered, to be heard and treated equal.
So be quiet, please, and listen. Don't assume, be open. Understand things in context. Slow down and follow a timeline that honors our expertise and ways of knowing. Commit to continued dialogue in all languages, not just one conversation or moment in time, because we need to figure out what we want to say sometimes.
Think about an equitable process and goals. Provide people with what's actually good for their bodies and not for the pockets of others. Tell us where you're coming from because we want to know. Listen and look and share. So that's a poem that we created collectively during our training back in the fall. And yeah, those are the things that are important to us when it comes to working with researchers and decision makers and health providers. What we hope that you will hear from us. So Trey's going to get us started with the first question, which is what's a community board and who are we specifically?
Good evening, everyone. Once again, extremely excited to be here with you all. And I'll jump straight into it. Dr. Edwards mentioned earlier, I'll just provide some additional points to what a community board is and who we are specifically, as a LEAP organization. So the definition of a community board in general is community boards are an essential two-way communication link between the city, respective cities, and specifically businesses, organizations, and resources with its residents. Community businesses and organizations use community boards both to convey important information to the residents and to listen to what those residents think. Community boards essentially serve as a bridge, as Dr. Edwards mentioned earlier, between residents and opportunities. Furthermore, the residents served can come to the board for answers to their questions and assistance with their problems. Knowing that through the board, they not only have a voice, but they also have the community's ear as well. So specifically us, I have 5 different categories we discussed in a meeting in which we thought who we were specifically as this community board. And the first subcategory is we listen to understand. So we work to create knowledge about the health issues that are impacting various communities. We look to serve all residents, no matter race, gender, socioeconomic status, or background. The second subcategory, we educate to balance. Understanding social determinants of health, and in addition to individual choices, we hope to raise awareness on the disproportionate amount of casualties that have occurred during the COVID-19 pandemic because of pre-existing issues with assessing healthcare. The next subcategory, we influence to inspire. We encourage residents to eat healthy and to take the time to exercise an adequate amount weekly. Having pride in the neighborhoods we serve, we hope to reflect that and urge residents to enjoy the communities they live in by taking advantage of trails, sidewalks, and parks for physical fitness. The next one, we connect to enhance. With our community connections and network of different organizations, we are in a position to improve the health within the communities that we serve. We pride ourselves in reaching underserved populations that would typically not have adequate resources for healthcare, healthy food options, and adequate access to physical fitness programs or equipment. We are aware that this is a collaborative effort, which makes our team even stronger because we bridge residents with different organizations that come together for a common goal. And lastly, we learn to serve. We stay informed about what is important in our various communities so that we can push those concerns to researchers, decision makers, and others so that they understand what's important to the residents that they serve.
Thank you, Trey.
Thank you.
We are, we're gonna hold off on questions until the end. So next, I invite Marisa to talk. And actually, I'm sorry, Nia is gonna talk and answer the question, why would someone want to work with us?
Okay, hello everyone. I am glad to speak to you this evening, and I want to tell you why someone will want to work with us. First of all, because the concerns of the communities can get to the ears of the people of Greensboro, how people are treated in healthcare, and serve as a bridge between the community and the local agencies and organizations. They will want to work with us because they want to get our opinions and understand the priorities, questions, and challenges of various communities. Also, they would like to work with us because to improve the community as a whole. You know, it takes more than one person, so we need people to work with us because of that, because if you're interested in improving your community or either somebody else's community, it is good to work together. Also, we have knowledge about certain communities as well as knowledge based on our lived experiences. We can direct the researcher to the questions or approaches to working with communities that are going to be most mutually beneficial. You will want to work with us because we have access to information that you may not have. So it can be very useful to work with us to understand a diversity of perspective. And also you might have information that we might not have, so you will want to work with us because we need that information that you have. We know our communities well, and we're committed to speak for ourselves, but we speak for whatever communities that we're representing. And that means that we are also invested in those communities so that we are always aware of what the concerns are, what the needs are, and what the goals are, all of that. And that's because we are a diverse group. We come from all backgrounds. We are trying to make a difference in the community, and that way, working with us, we can do it together.
Thanks, Cornelia.
Mhm.
Next is Marisa, and she's going to answer the question first for herself and then sort of represent some of the responses from other community board members about why do I do this work? Why do we do this work?
Thank you, Kathleen, and thank you all for joining us this afternoon. I wanted to answer this question specifically because I do this work because I've been in spaces where people like me don't have a seat at the table and our experiences become invisible or misunderstood. And so through my work with the LEAP Community Board, I want to ensure the challenges, experiences, and perspectives of our diverse communities are voiced and represented accurately. And now I'm going to raise some of the voices and perspectives of some of my fellow colleagues on the community board. And a few of these go like community members suggested that they wanted to be, that they do this work because to be a bridge to communities, to improve the health of people, especially in underserved communities where they don't have access to different resources. And because we're called to do this work, because it keeps us humble, to better our communities, info to people to improve a way of life, helping soul. And it's because it's a matter of fairness and equity and accessing a healthy and fair lifestyle. The suffering always falls disproportionately on marginalized communities. Another community board member said, in Greensboro, still resources are spread unevenly and that's not only for people of color and lower income. So as a person of color and as a sociology major, I want to help change that. So that's why I do this work. Another member suggested, I'm doing this work for accountability as I work on getting healthy and developing better habits and also to serve the community. And lastly, another community board member suggested to prevent exploitation in research, as well as to encourage greater diversity and participation. Also, I want communities to be able to active, influential, and collaborative partners in research. Thank you.
Thanks, Marisa, for representing all of those different voices. We've used the word communities a lot, and we're using it sort of generally, but we thought it might also be good for you all to have a sense of kind of like what are some of the specific communities that our community board members are connected to. There's an idea that loose networks are actually really beneficial to helping make connections. And I think what this community board can show is that it does have connections in a variety of different communities, whether that's neighborhoods, faith organizations and faith traditions, different types of areas of work. And so I'm just going to invite Trey and Marisa and Nia to speak specifically about some of the communities they feel connected to, and then we'll also go through some of the ones that other community boards members represent.
Absolutely. So I would like to start one of my most recent and most proud communities that I feel connected to is the homeless population. I serve as the general manager of the Greensboro Sportsplex. And at the brink of this COVID-19 pandemic, we actually shut down our facility, but then opened it to the IRC, the Interactive Resource Center, to bring in our homeless population so they would have a safe place to live, receive food, shelter, and to bathe. So that's one of the more recent and more proud communities that I feel connected with now. Also, the local colleges and universities with my experience. My previous experience as a marketing director at Winston-Salem State University had to often collaborate with different athletic departments and even different universities and colleges in general. And I would also say the residents of the great city of Greensboro, North Carolina, since I do serve in the general manager role, which falls under the city of Greensboro umbrella, I definitely feel connected to all residents.
Cornelia, do you want to talk about the communities that you're connected with?
Well, I have been previously, well, I'm still connected to the homeless community because I get my family, you know, my children and some other friends of mine, and every few months we collect items to take to the family shelter at the YWCA because they have children now. So we get supplies for the children and food for the children and take there. And, you know, I was previously employed at the IRC, so I can see a lot of need for in the homeless community and also religious community too. You know, because, you know, there are a lot of religious communities and they can do a lot of things in the community, and people will look to them because there's so many different religious communities. So that's another program that I'm connected to, another organization, a religious community.
Cornelia, I think that you also shared something really lovely on this past week when we were meeting and when you were talking about how you view community and how you really wanted other people to think about community. Do you want to share that right now?
Oh, when I said that our community is everyone?
Yeah.
Oh yeah, I said that our community is everyone, not just us, not just us, but it's everyone. It's the people that need help, to the people that are happy, to the whole city is a community. Homeless community, low access to healthcare community, religious communities, and it's not just one person or one just community. It's the whole city of Greensboro. To me, is the community, the whole city.
Thank you.
Mm-hmm.
Marisa. Yeah, so I was born and raised in Greensboro, and I still live in the same 27405 that I have lived since day one. And so I feel very connected to this community over here near McKnight and Cone, behind the Walmart on Cone Boulevard. And so I particularly feel connected to this community because it's an immigrant community primarily, but it's multicultural as well. So there's a lot of folks living here, and I feel like there's a lot of important work to be done in these communities. Also, I'm very connected to the diverse churches that my family members and different neighbors belong to. And so those are in other communities that we have access to. Another important element is there's a lot of health groups in Greensboro that are for different reasons that provide different exercise routines and dietary supplements. And so this is a very important group to also reach out to when requesting information about research about health and activity for Latino and immigrant populations. And so those are some of the groups I have access to, as well as graduate students. I am in the doctoral program at EOC at UNCG. And so those are also folks that I have access to. So thank you.
Great, thank you. And Lynette, would you be willing to talk about communities that you have access to? Even though I know you're not part of the panel.
Sure.
Thank you.
I live in the northeast section of Greensboro, and I live in New Garden Place Apartments. So definitely that area. I represent my apartment complex. And I'm also a community resources specialist at the Women's Resource Center. So at the Women's Resource Center, and then also my church, I attend Purpose House. And so I represent my church.
Yeah. Thank you, Lynette. And we do have other people who unfortunately couldn't make this evening but they want to make sure that you understand who they're connected with in their communities. So those include also addiction communities. So we have some folks who are very aware of how people who have addictions are often not reached out to when it comes to talking about healthy eating and physical activity. And so that's an important community for a couple of our members in terms of always keeping them in mind. We've talked about people experiencing homelessness. Kind of relatedly is just the variety of people who have with contract jobs or gig jobs, people who are working but don't have health insurance. And then we also have some folks who are connected through the communications department. Actually, there's a group there called the Center for Communications, Community Collaborations and Change at UNCG. And it's a community engaged effort there. And one of our members, and Marianne, you can speak to it some too. Yes, thank you.
If you want me to talk a little bit about it.
Yeah.
Very, very quickly, we were sponsored by, as a communication studies department, our national organization, the National Communication Association, to be this very first center. It's designed to be a traveling center. So every 2 years, it's supposed to go to a different community, and they're going to decide whether or not to keep it going after our group does our work. But we've been able to fund 5 different community partnered activities. And so we've been working with the Greensboro History Museum, the Corner Market and the People's Market, who are working together around some SNAP EBT initiatives, also some work with the Greensboro Public Library. And it's intended to build community collaboration around important social issues, particularly related to social justice in our communities. And so there are some intersections there with the work that LEAP does, particularly around health and physical activity and kind of the shape of our communities and our neighborhoods.
Thank you, Marianne. All right. So I'm going to ask the community board members if they feel like there's anything we've left out that they want to share right now. And then after that, we'll open it up to any questions from people who've joined us tonight.
Did you want to talk about the elevator pitch, Kathleen?
Do you want to share do you have an elevator pitch that you want to share?
Well, I know when we talked about it last time, we said our elevator pitch, one of them is that we are making a difference in the community, and that we have people leave with a positive image of the board doing good work for the local community. I know that's one of them that, the elevator pitch to have.
Yes, that's an excellent elevator pitch. Yes.
They can have something to take with them to show to other people, know.
Mm-hmm.
And I guess to follow Cornelia up, I think I just want to reemphasize that we just want to be a research warehouse with an open door policy that serves as a bridge to agencies and people that need and want information, because we have the networks that could be the answer to their questions or concerns.
And I think I would add additionally to that what community board members are committed to is understanding what the concerns and the priorities are of their various communities. And so when someone who is thinking about some future research, or when someone is in a position for making decisions related to particular populations, the community board can be a really good connection, because we can be that sort of first stop for you if you aren't sure yet how you want to get connected with specific folks in a certain neighborhood or with a particular group. And on top of that, I think that community board members can be really helpful at helping us understand what the reality of on the ground experience is for people. So while we might have an idea of research that we want to do, the community board can let you know whether or not that aligns with what that neighborhood's priorities are, or that population's priorities are. And so that it can improve the chances of creating a mutually beneficial relationship when that research gets started. So we want to thank everyone for being here this evening and learning about us. And now we would just like to open it up to you all to see if you have any questions for us.
So I always have questions. Thanks, everybody, for being here. You know, this is the forming stages, and we've been probably 4 or 5 years in getting to this point. The folks who began to talk, and then it evolved into LEAP, and this concept of community engagement around health and wellness is like pushing a rock up a hill. It's really, you know, we've got to be in this for the long haul, because it seems like we're just slogging away at this, and we make little progress. This is a long haul problem, and we're in this for the long haul. And the temptation is to just get exhausted and give up, because others in the community have done that. We've seen that and lots of different initiatives. So really appreciate that you guys are here. And I'd love to know some about what you guys on the board see yourselves being. We just spent 3 hours this morning talking about LEAP and what we want it to become and what we envision it to be, our strategic plan, if you will. Have you all talked about, or as this evolves over years and thrives and grows, what would you want it to be or hope it becomes?
And
I'll invite anybody who's on the call to say what you would hope from this endeavor as well.
For me, I think that's an awesome question. For me personally, I'm relatively new to the board. I've only been a board member for about 3 months, but when I first came across the LEAP community board, I envisioned it to be an extension of what researchers could provide in terms of information or resources to underserved populations within the Greensboro community. I think at times in certain communities, there's a distrust when a message is coming from particular organizations or particular businesses or healthcare industries, when the person doesn't look like the person receiving the message. So I think with a diverse community board such as this one, I envision it just being an extension of you. And you are the expert in your field, the medical industry, or the healthcare industry, I should say. And we understand there are certain detriments that impact certain communities more than others. So being able to communicate your message in a way that is able to be received and I guess genuinely received, and not just listened to, but understood as well. I think that's what I envision us being, just an extension of a tool to help people across the board.
I echo that, Trey, too, as well, because as we've repeated over and over again, right? I envision us continue being this bridge, right? Because of this trust that there is. I mean, for immigrant populations, and specifically, there's a lot of distress against like immigration status and the language barriers and different factors like that, that like when someone externally, like a researcher comes and tries to be like, let me do this, there's a lot of like, what if they're going to do this? What if they're going to do that? And so really having folks that can speak to these communities, I think will be fundamental in order to push the needle, and really have authentic research, that gets to the heart of what the problems are in the communities and how researchers can use that information to better these communities. And so that's what I envision, how we can serve and continue to serve both sides that we care about.
And I see that that we need to, one thing that we could do, or we need to do, I see myself helping to do this too, is to ensure that the challenges and experiences of the communities are voiced and not invisible, that people hear what we are saying, that people hear what the community is saying, that people actually listen to what is going on.
And I was going to say, I think that was a great question, but understanding that this relationship is a two-way street, what would you envision this board doing if we haven't touched on it, or if we have, I guess, what should we emphasize even more?
Yeah, for me personally, as a physician, we are coming to the understanding that the messages we deliver and the care we provide does not translate to the patients we are treating. And it makes me, to think of all the years of advice or suggestions that haven't been appropriately tailored to the audience intended because I just didn't know. And we're just kind of waking up to that. We're just beginning to understand that. And we had a panel a few months ago with Latinx students, and man, it was eye-opening, and it was emotional. It was moving to understand what we don't know. And so for me, this is a huge step in understanding all of these communities, and we're serving all of them. We're just not serving them as best we can.
And this is Laura Vale from Cone Health. I just echo what Jake just said, and I would just ask those of you on the community board, like, is there an example of something that that you could give that you think your voice really mattered, like it was headed down the wrong path? Like, we think in terms of solutions, and we often don't offer the right solution. And I was just wondering if there is an example that someone might have of just where you corrected the course and took it in a different direction.
I certainly want community board members to be able to answer that if they want. But I would also share that, this is sort of our debut. And so we haven't had the opportunity yet to work with a lot of different folks. We've some of the things that we have done include offer feedback to questions that were coming out of the healthy communities at Cone. There were some general questions that they wanted to ask. And so we offered feedback to those regarding those questions. We've had people who were interested in some startups come and talk with us about those startups. They were garden hydroponic related startups. And then the other thing that I would just lift up, and then I'm gonna let other folks talk, is in the fall, as we were describe, like asking ourselves, what are the challenges that we encounter as it relates to physical activity and healthy eating? It was really obvious to me that many of the challenges were things that were not about personal decision-making, but they were things like transportation, proper lighting in an area so that they could feel safe while they were out exercising, how close or far away they were from a grocery store that had fruits and vegetables. And one other thing that really came up a lot, and we're not talking about, and the Latinx panel in the fall emphasized this also, is the connection between physical health and mental health. And you know, with LEAP, we are focused very much on physical activity and healthy eating, and we've expanded to understand like that, okay, social determinants impact that as well. But you know, from the board, there's also a conversation around mental health because it is so deeply connected with our physical health. And we'd love to lift that up. So other board members, what would you want to add?
I wouldn't say it changed the course, you know, but I also attended the LEAP InProcess meeting in December because most of the members on that panel, one of them was my cousin, another one was my neighbor. And like, it just, you know, it goes to show like how like that, just that little session, you know, provided this wealth of information, you know, and that like, and just afterwards, how that felt for us too, you know, how that felt for the ladies that I'm working with and this, because they're first year students at UNCG. And so how impactful it was for them to voice these concerns and how, you know, doctors like yourself, you know, like receive that, you know, and how like we thought this was like common knowledge and it wasn't, you know. And so these are the type of things that I'm like, well, like we can make a big difference and we can just talk, you know, talk directly. And so I don't know how much that had changed the course, but I know, like we said, change is slow, but with these conversations, it's at least starting.
Thank you. And I think that December conversation was a really important conversation. So I watched it because it was recorded. So I was able to see it later, but I really did think that was an important conversation about language. Thank you.
I'm not sure if I have a question or something to think about as you all continue your work. I had an idea this morning. I'm not going to say what the idea is because I think it gets us off track. But I had an idea this morning about something that the community board might be able to do. And Kathleen's response was, that would be like 10 community boards. And it got me thinking about how we're really excited to have you as part of this. But I think we also want to recognize the limits of what we need, what we can ask you to do. And I don't know if you might know those limits yet. You might not have thought about them in terms of like, how much is too much for the larger LEAP board to ask of the community board, which I see you as also part of the larger LEAP board, but like, as we all meet, like what is too much to ask of the current board? And I think about it in terms of your time and how we're able to pay for your time. If we're starting to ask too big of questions and things like that. So again, I'm not really sure it's a question as more of a thing to ponder as you all continue to meet in terms of helping us know, particularly those of us who are coming at this from the higher ed side, where we're all a bunch of workaholics and we'll just keep going and going and going and not even think about it. But to really all of us think about what are appropriate things for us to ask you to do and to be a part of. And then also to let you feel comfortable saying to us, hey, we need more help and resources to be able to do the work that you're asking us to do.
Board members, anyone want to respond to that? Even just a reaction?
I'm sure Kathleen and Kathleen won't let you guys take advantage of us. So, no, I think, I don't know. I think that's something definitely to wonder about for sure.
Or at the very least, I wanted just us to bring it up in terms of if there's ever any a time that you feel like we've been asking too much of you, because you're all excited to do this work too, and I think we're excited about that, and I don't want it all to spin out of control and all of a sudden we all burn out. I think about that a lot because I'm an organizational communication person, and I don't want to put too much on you, but at the same time still totally invite you to run with this as much as you want. I'm gonna go mute myself again. Bye.
You know, one of the things that I think about is, again, this is long haul work, and developing the sustainable vehicles. So those who come after you or me, you know, this again is the very beginnings of that dialogue and that communication that we should be having here in the community. So I would charge you guys as you go along and have your continued forming part of this, that you really do think about sustainability, because for me, chronic disease and primary, it has a huge inertia. It will win. It will beat us down, and we will all drift away from just exhaustion. And you always got to have people engaged who are fresh and new, and so I just challenge us not to ever let this kind of an effort do anything but get bigger and more robust and self-sustaining.
It's really encouraging, Jake. Thank you.
I read a book about trees. I don't know if I mentioned this before. That's kind of how boring I am. And the quote, and I think I've seen this quote then again, and it was the best time to plant a tree was 20 years ago. The second best time is now. You know, so what we're doing right now won't bear fruit for a long time in some respects, but it will for my kids, you know, and it will for generations to come if we do it differently than our parents did it, or, you know, it really isn't. This is an effort for the future.
Yeah, and I think to sort of add to that, you know, part of what a community board can do is inform the direction of research, which is about knowledge creation, right? So, you know, rather than this very top-down approach that makes people feel like they've been used or abused in research, when you can have this collaborative type of conversation and from the beginning plan together so that, you know, the research and your findings and what happens with those findings is mutually beneficial, then I think that's when everyone wins. So. Emily is asking, can you speak to the professional development that is needed as an aspect of board development? So does anyone want to answer that question? I can take it if no one wants to answer it. So I think that our professional development is subtle, and that it is it's experiential. So for example, one of the things that is happening with regard to professional development is that everyone on the community board has agreed that they want to work on a research project. So, you know, while previously they may have not done a whole lot of research, they're going to be going through that process of conducting research themselves so that they can really better understand and give advice to and respond to what the questions that researchers come to them with, in a way that recognizes not only the content, but the process. So that would be an example of the professional development that we're doing.
Thanks, Kathleen. My question, and the reason behind it is I think sometimes folks think of a community board as just being invited and then you show up, and there's not work that's being done between meetings. And so in the best boards, right, like where people get paid hundreds of thousands of dollars to be board members, right? There's board development and there's really important training. And so what I've really appreciated is that is also taken seriously with regards to the community board. And so I think that's an asset that is being developed through this board that is not only an example to others, but it can also, and then we talked about like, can it be a model, you know, that kind of thing, but like really helping so that there's the LEAP community board, but also thinking about how is this something that is picked up and used not only in Greensboro and Guilford County, but nationally as well.
Mm-hmm.
Thank you.
Yeah.
Whose science, like what field of study does this science come from, or this structure, or what are the paradigms or models that you followed? I mean, this is something that has a way of doing it.
Yes and no. So community boards are very often practiced in areas of community engagement work, and also specifically in public health. Because public health is really focused on ensuring that the community members' voices and priorities are both listened to, reflected, and prioritized. And so community boards, there are models, but they're very different. There are some boards that are only advisory. There are some boards that are picked specifically because they serve a certain population. So for example, in Greensboro, there is the Martin-Yard Dega Association that has created a community board, and that is specifically for researchers who are interested in working with Montagnard population. And that community has said, listen, we've had enough experiences with researchers that we need to, we have our own set of expectations and ways that you need to, information you need to understand about us and how we operate in order for this to be a good partnership. So the boards can take a lot of different, they can look a lot of different ways. For me, I think the most important thing with the community board is that it's shaped by the community board members themselves. And so what we've done is spent a fair amount of time getting to know each other and building community, trying to do some trainings around like even understanding like the language of, you know, research and science and, you know, that sort of stuff so that people have the confidence to then decide like, okay, this is the direction we want to take our board. And I think that, you know, in the next couple of meetings, we are ready to start talking about like, what does our leadership look like? What does our decision-making process look like? What kind of messaging do we want to put out there on, do we want to put out there in general about just like community members and their stories and their perspectives. So I hope that answers your question.
Mm-hmm. Yeah. Okay.
Well, it's 8 o'clock, so we've been together for an hour, which I think is a good amount of time for a Tuesday evening. I want to thank everyone for joining us, for asking great questions. And I'll just mention again, I dropped it in the chat, but if there is anyone who's interested in working with us, maybe it's just to have, you know, a starter conversation, or maybe you have something really specific in mind, you can reach us at LEAP, LEAP at uncg.edu. So that is our contact information. Thank you, everyone, for being here tonight with us.
Thank you.
Have a good evening.
Have a good evening.